Hello again. This is In the Know with Dr. A. Today we're going to answer the question: does purpose matter to your health and well being? And what can you do about it? For many of us, we're doing the things we're supposed to. We're eating reasonably well, getting some exercise, and keeping up with our checkups. But there's a sense that we're going through the motions. That feeling isn't just psychological, it's showing up in your body. A growing body of research reveals that having or lacking purpose is one of the strongest predictors of health outcome, stronger than many factors your doctors actually measure. People with purpose live longer. They have fewer heart attacks. Their inflammation markers are lower. They stay physically functional as they age. The effect is so large that the American Heart Association now recognizes purpose as a component of cardiovascular health. Here's what the research shows and what you can do about it. Researchers pulled the data from over 136,000 people, and they found that individuals with the strongest sense of purpose had a 17% lower risk of dying from any cause. They also had a 17% lower risk of heart attacks and strokes, the things that kill more people than anything else. What's even more impressive is that there's some studies that even show larger effects. One study in the US that tracked people over 4 years found that those with the highest purpose had a 46% fewer death, even when you control for depression or any baseline medical problems. Imagine 46% less death in those individuals with purpose. That's not marginal. That's a major protective factor hiding in plain sight. What is it about purpose that provides that level of protection? In studies of over 50,000 people, having purpose is correlated with lower C-reactive protein, a key inflammation marker. Chronic inflammation drives heart disease, cancer, and cognitive decline. Purpose also predicts stronger grip strength and faster walking speed in older adults. Those two things are among the best predictor of independence and longevity in older adults. But the impact of purpose doesn't just stop there. Purpose makes you do good things for yourself. The data shows that people with higher purpose are 24% less likely to become physically inactive, 33% less likely to develop sleep problems, 22% less likely to develop unhealthy BMI. When life feels meaningful, you treat yourself differently. So what is purpose? Well, purpose isn't what many of us think. This is where many of us get stuck. We think that purpose means having a dramatic calling or a singular life mission. It doesn't. Researchers define purpose simply as having goals that provide direction and the feeling that your daily activities matter. A professor from Stanford who has studied purpose for the last 20 years has that purpose typically involves contributing to something beyond yourself, the family, community, a craft, a cause. A hospital janitor that sees herself as part of the team that keeps patients healthy has purpose. A retiree mentoring young people has purpose. A parent who views raising a child to be a good person has purpose. So how do we build purpose? What actually works? The encouraging news is that purpose isn't fixed. And here's what the evidence shows. You need to know your values first. The Center for Healthy Minds recommends starting with 3 simple steps to clarify your values. Step 1, list what matters most to you. Is it family, creativity, justice, social connection? Second, examine how these values appear in your actual daily life. And third, notice where there's an alignment and where there's a disconnect. Many people discover that their lives slowly drift away from what they care about, not through dramatic choices, but through small trickles. There are several ways to bring purpose into your life. The most reliable purpose builder is volunteering, but the type matters. Look for work that aligns with your values, lets you see your impact, uses your skills, and make sure it includes social connection. The evidence is clear. Volunteers show higher dopamine, lower stress hormones, and reduce mortality risk. In other words, a reduced risk of dying. The good news for most of you is that you don't need a new purpose. You need to see the purpose in what you already do. Look at your current activities and ask yourself, who benefits? What would be missing if I didn't do this? How does this connect to something larger than me? It is good to know that most people find that their lives already contain meaningful elements that they stop noticing. The professor from Harvard tells the story of Mark, a student working at a fast food restaurant who reframed his job from flipping burgers to feeding the families in his community. Same job, different meaning, a purpose. One important thing to understand is that research consistently finds that contribution, adding something to others, is the center part of purpose. This doesn't require heroic action. You can teach something you know, create things others will use, support people going through hard times, care for those who are in need. At the end of the day, the goal isn't to make every moment meaningful. It's to ensure your life has enough purpose-directed activity to reap the benefits. The research supports what many of us already know. Feeling that your life matters keeps you alive and healthy longer. And as we shared the evidence, it does it by decreasing the risk of death by 17%, lowering our cardiovascular risk, strokes and heart attack, better sleep, more activity, less inflammation, preserve physical function. These effects persist across age, gender, and ethnic groups. Your clinician won't likely ask you about your sense of purpose. It won't show up in your blood work, but the evidence suggests it matters just as much as anything that would. So as you ponder on your purpose, ask yourself, what am I oriented towards? What am I contributing to? Find answers, and you may have done more for your health than any supplement could ever offer. And with that, until next time.